Okay, so let's go down to your ear. Inspection, your ear are properly aligned, which is within 10 degree of from the lateral canthus of your eyes. And I don't see any abnormality or any redness noted or any extra growth of muscle around the ear. I'm going to go ahead and palpate your tragus and auricle, and there's no tenderness or any mass or lesion or any lesion. Your mastoid process, also no tenderness. Okay, so I'm going to go ahead and inspect inside of your ear using my scope. Okay, I'm going to pull back and up, and I can see your canal is clear of cerumen, and they're clear, no lesion or any mass in there. I can see your tympanic membrane are pearly gray, and there's no bulging or perforation. Cone of light is visible. Let me come and look at this ear. Okay, there's some cerumen on this ear, in this ear, and your tympanic membrane also are visible. Pearly gray, no perforation or bulging. All right, very good. All right, we're gonna go down to do some kind of hearing test. I will do a whisper test. I will whisper 3 words and have you repeat what you heard, okay?
1, 2, 3.
Okay, good. Now I'm gonna go down to go ahead and test for this is called a Weber test. I will strike this tuning fork and place it on top of your head. You let me know if you hear better in one ear or equally.
Equally.
Okay, very good. All right, next test is the rhyme test. I will strike the tuning fork and place it in the back of your ear, and you let me know now when you no longer hear the sound. And I will place it right next to your ear, and you let me know when you no longer hear the sound, okay?
No. No.
Okay, so the air conduction is twice as long as the bone conduction, which is the normal finding. All right, we're gonna go down to assess your neck, and I can see your neck is in the midline, and there's no abnormality. Your curvature is normal. There's no webbing or any mass. There's no GVD, no JV distension. I'm gonna go ahead and palpate for your thyroid. How can I have you swallow? All right, and your carotid artery. Good. And your trachea. Go ahead and relax. Yeah, your trachea is in the midline. Carotid arteries are palpable and they're regular, 3 out of 3. And your thyroid gland is not enlarged. All right, I'm going to go ahead and auscultate for any bruit on your carotid artery. I'm going to have you take deep breath and hold it, okay? Hold it. Okay, breathe. One more time. Breathe and hold it. Okay, breathe. Hold it. All right, good. I don't hear any bruit on the carotid artery or thyroid gland. Okay, relax. I'm gonna go ahead and palpate for your lymph nodes. This is our pre-auricular, post-auricular, occipital, tonsillar, submental, and submandibular, supracervical chain, deep cervical, post-cervical, supraclavicular nodes. All right, all your nodes are not palpable, which is normal. Okay, so now we're gonna go down to your extremities, your shoulder. You're gonna look at your shoulder, and there's no bulging or tenderness or any mass and any instability on the joints. And I could see your arm. They're warm and they're dry, and all the joints are intact with no abnormalities. Your nail beds are pink, capillary refill less than 3 seconds, and there's no clubbing. Alright, very good. And the hair on your arms are evenly distributed. I'm going to palpate for your pulse. Okay, your pulse are regular, 3 out of 3, and equal bilaterally. Okay, I'm going to check for your range of motion. I want you to start doing a Popeye movement. Okay, good. Okay. And muscle mass are pretty good. Okay. Go ahead and squeeze my hand. Okay, and push and pull. Good muscle strength, 5 out of 5. Alright, I'm going to go down and look at your back, and I can see your curvature. Going to have you turn this way, and your back is with the normal curvature. There's no scoliosis or kyphosis. I'm going to go ahead and palpate your spinal process and your paravertebral muscles along the spine, and there's no mass, there's no tenderness. Alright, I'm going to go ahead and check for your CVA tenderness. I'm going to stop at your back and let me know if that hurts. Good, so it's negative CVA. Okay, next lungs. I can see he's breathing normal, regular, and non-labor, and chest rise is symmetrical. I'm gonna go ahead and palpate your chest wall, and there's infra-axillary node, and this is not palpable, which is normal. Okay, all right. I'm gonna do a tactile fremitus, and I want you to say 99 when you feel my hand touching you.
99, 99, 99.
Okay.
99, 99, 99, 99, 99.
Good. So vibration is palpated equally bilaterally. All right, I'm gonna go ahead and do a chest expansion, and I want you to take a deep breath in, out. Deep breath and out. And chest expansion is equal bilaterally. I will go ahead and do a percussion along your chest wall, along your chest fields. Okay, all lung fields are resonant throughout. I will do the diaphragmatic excursion, and I'm going to have you take a deep breath in and hold it, okay? Okay, breathe. All right, this time I will have you exhale all the air out and hold it, okay? You ready? Okay, exhale all and hold it. All right, breathe. And the diaphragmatic excursion measured to be 3.5 centimeter, which is within normal finding. Okay, so now I'm going to do a auscultation of your lung fields. Breathe in, out. Okay. Breathe in, out, in, out. One more time. One more time. One more. Okay. One more time. And good. There's no adventition sound noted in all lung field, and they're all clear. Okay, now I'm gonna inspect your heart. Your heart, I don't see any heaves, lift, and I'm gonna go ahead and palpate your pericardium area. Okay, can I have you turn this way so our camera can see, and I could palpate his apical pulse, but there's no trio, no lifts, no heaves noted. Okay, so I'm gonna go ahead and auscultate your heart sound and heart quality of the heart. I'm gonna using the diaphragm first, aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. Aortic, pulmonic, Erb's point, tricuspid, mitral. Okay, there's no murmur noted, and heart rate is regular, 3 out of 3, and normal. All right, I'm gonna go ahead and have you lay down, and we're gonna go down to assess your abdomen. Your abdomen is round, and I don't see any aorta pulsation. I could see there's some hair along the lower abdomen, and I'm gonna go ahead and auscultate for your bowel sound. Your bowel sound are present on all quadrant. Okay, I'm gonna go ahead and while you lay down and auscultate for your arteries for brewing. Aorta, renal, iliac, and femoral. There's no bruit noted. Okay, I'm gonna go ahead and palpate for liver span. All right, let's go ahead and start from the top. Okay, so your liver span is measured to be 4 centimeter, which is more than normal finding. I'm gonna go ahead and percuss for your spleen. Okay, so there is a small area of spleen dullness, which is normal. I'm gonna go ahead and percuss along your 4 quadrant, and they're tympanic throughout all 4 quadrant. Good. Okay, I'm gonna go ahead and do a palpation, a light palpation, and I don't see any guarding. There's no muscle resistance, no tenderness. I'm gonna go ahead and do a deep palpation, and I don't feel any mass. All right, okay. I'm gonna have you take a deep breath in and exhale all the air out and hold it. Hold it. Okay, one more time. Exhale all the air out and hold it. Okay, breathe. No liver, border, or spleen are palpable, which is good. Okay, I'm gonna go ahead and palpate for your kidney. Okay, no enlargement of the kidney, noted. Okay, all right. So I can see that your abdomen muscles are all good and there's no abnormality in your abdomen muscles. We're gonna go down to your hip, and I can see your hip is symmetrical aligned, and there's no crepitus or any instability of the joint. Your leg hair is evenly distributed, no edema, and they're warm and dry. And capillary refill on the leg is also less than 3 seconds. I'm gonna go ahead and palpate your pulse, dorsalis pedis, posterior tibial, popliteal, and they're all equal bilaterally, 3 out of 3 regular. Okay, now I'm gonna test for your range of motion of your hip, abduction and adduction, rotation, and everything looks good. Abduction, adduction, rotation, and good muscle mass. All right, I'm gonna have you, I'm testing for your muscle strength. I want you to push against my force. Pull. Okay, your lower leg. Good muscle strength, 5 out of 5. Okay. All right. Go ahead and sit up. I need to do a textile femidus on your lungs. I want you to say 99 when you feel my palm touching you.
99, 99, 99, 99, 99, 99.
Okay, very good. Now I'm gonna go down to do a quick 2-point discrimination test. Okay, I want you to close your eyes and you let me know if you feel 1 or 2 points pointing you. Okay?
2, 2.
Good. So 2-point discrimination is also negative. Okay. Now I'm gonna do a deep tendon reflex. I want you to relax. Tricep. Bicep. No, hold on. Bicep. Tricep. Brachial. Patellar. And Achilles. Bicep, tricep, patellar, and Achilles. Okay, so this will conclude our head to toe examination, and thank you for reviewing.